morning, Lake Providence Church family and friends. This is Dr. Linda Plum Award. Thank you so much for joining us for another health ministry moment. I'm going to make this as quickly as I can because it's a long video, but I think it's something we need to talk about, and that is side effects, risk, and benefits of the COVID-19 vaccine. So about 65% of the U.S. population now has received at least one dose of the vaccine. 55% of the U.S. population over age 18 is fully vaccinated, and over 140 million are fully vaccinated in the United States. The Delta variant from India is now in 40 states and about 80 countries worldwide so far. Some countries are starting to do temporary travel restrictions to slow the spread. The variant has risen to about 10% in the United States. The UK variant is still number one. The Pfizer and Moderna vaccines are effective after the second dose, though. So it's important to get both shots to be fully vaccinated and protected against the variants. J&J is also effective, but slightly less effective than the messenger RNA vaccines, Pfizer and Moderna. So are you still concerned about taking the vaccine? There are many who are. It's important to be informed with the most accurate information from reliable sources. Once informed, we have to weigh the risk and the benefits to make decisions responsibly. And what do we mean by risks and benefits? Well, pros and cons, so to speak. You see, God has given us access to knowledge and the ability to reason unlike any other being on the planet. He gave us wisdom and discernment, and we can talk to Him in prayer. The Holy Spirit is here to guide us. Through His Word, we have direction. It's up to us to inform ourselves and not to listen to everybody and everything. Once informed, we ask ourselves, is this going to be more beneficial for me than it is likely to harm me? We make these decisions every time we take an aspirin or a Tylenol for headache. We weigh these risks and benefits when we walk across the street, when we fly in an airplane. It's the same dilemma we have when we have surgery or when we get married. This is not a gamble. It's a process. Prayer and faith removes doubt and fear and gives us peace and confidence in a Holy Spirit-directed decision. Let's review a few facts about the COVID-19 vaccine. Scientists worked with the messenger RNA for 25 to 30 years before it was produced as a vaccine for this pandemic. So while it's new to the public, messenger RNA was known to scientists who studied a version of it for Ebola and even influenza, but it was not used worldwide as it is now. We've learned that clinical trials were not rushed, steps were not skipped, and the testing and clinical trials were run simultaneously or parallel to each other rather than run a test, get the result, start another test, get the result. Wasn't done that way as it usually does, which takes years. So that really cut the time of the trials. This is not a pharmaceutical ploy to make money. This is one time that nations have come together from all over the world to fight a pandemic that has killed millions worldwide. Some of the usual red tape was not required to allow the companies to work more quickly on a vaccine as far as development and production. The production began before the FDA's emergency release authorization to quicken vaccine distribution to the masses. The vaccine does not cause COVID-19. It doesn't interfere with infertility, and this is not a conspiracy against African Americans. It isn't withholding of treatment as it was with the Tuskegee experiment or unauthorized use of our bodies as with the Henrietta Lacks case. This is a pandemic that affects all humans worldwide, and this time we are withholding medical treatment from ourselves. Yes, African Americans were affected disproportionately. In fact, all people of color and essential workers as well were affected disproportionately for socioeconomic reasons. Many of the chronic illnesses that put us at higher risk have socioeconomic roots. Now, there are no microchips in the vaccines to track our locations or our actions. And while we're unsure of the origin of SARS-CoV-2, we do know that it causes COVID-19 and not the 5G towers causing radiation sickness. That's not what we're seeing. The effectiveness of the vaccines is apparent by the decrease in severe illness, hospitalization, ventilator use, and death. But vaccines don't save lives. Vaccinations save lives. The variants are here, and they're infecting people throughout the nation. Those unvaccinated, those with chronic disease and weakened immune systems, and those under age 65, not over, but under age 65 are included in the most at-risk category. 76% of those over age 65 are vaccinated and less likely to get severely ill if they get it. Even though the mandates are lifted, the pandemic is not over. People are still getting sick, being hospitalized, and dying. And fortunately, thanks be to God, at a much lower rate than what we saw before. Most of these are the unvaccinated. The safety profile for the vaccines is well documented and continues to be monitored very closely. So what are some of the benefits of the vaccination? Well, vaccination affords protection from COVID-19, of course. And this is an unpredictable infection that can cause long-term effects. Vaccination gives you freedom from most of the COVID-19 restrictions when around other vaccinated people. It gives you the ability to return to a more normal life. Vaccination does not completely eliminate risk, but it is shown to significantly reduce severe illness and death from COVID-19. It decreases the spread to the unvaccinated, the high-risk persons, and those that can't take the vaccine. It gives us the opportunity to join the worldwide race against the spread of variants and put the nail in the COVID-19 coffin to put this pandemic behind us. Now, what are some of the risks of vaccination? Well, we know the side effects from the vaccination may include a sore arm or redness or rash locally. It can also cause body aches, fever, and headache. Some people have no symptoms at all after vaccination. The more serious reports of side effects that are presently under investigation are as follows. For the messenger RNA vaccines, Pfizer and Moderna, what we've seen so far have been anaphylaxis or severe allergic reactions, and that's been a rare occurrence. It occurred in 2 to 5 people per million vaccinated in the United States, usually in individuals with a prior history of allergy, and it usually occurs immediately after the injection and is easily treated. As you know, anaphylaxis or severe allergic reactions period, can occur after any vaccination or any medication or food for that matter. Heart inflammation is another one that we've started to see. You may have heard myocarditis or pericarditis. It's referring to inflammation of the heart. These cases have been mild. They're also rare. As of June 9th, 2021, there were 268 confirmed reports under investigation. And these are, as I said, mostly mild inflammation. And these are patients who are less than age 30. No deaths have been reported. For Johnson & Johnson, which is an adenovirus vaccine, we've seen an autoimmune reaction, also a rare occurrence. Johnson & Johnson was paused for this reason. As of June 7th, 35 cases out of 11.2 million doses given in the United States have been monitored. Causes have been low platelets and blood counts. It's seen more often in women aged 50 and younger, and it's not related to birth control pills or hormone therapy. What are the risks of no vaccination? Well, none. You can have nothing happen. You can actually be a part of the spread among the unvaccinated. You can, in younger people, we're seeing more cases in younger people now. And by younger, I mean less than age 50. And those over 65, as we've said, are more likely to be vaccinated than not. So they have more protection against it. So they are not at as much risk as those who are younger and unvaccinated. Take a chance? You sure can. Youth and good health are in your favor if you are young and have good health. However, this is a very unpredictable disease that can sometimes cause symptoms long after you would expect recovery from it. But that's the chance that you take. There's no way to know that it's going to be a mild case or if it's going to be a severe case that causes hospitalization or death. The other risk is infecting high-risk contacts. High-risk contacts. That means people that you're around. If you become infected and you're asymptomatic, you can pass it on to them. And finally, the risk is dealing with a smoldering pandemic or another surge as variants continue to spread and continue to replicate. We understand that the decision to take or not take the vaccine is a difficult one. It can be unsettling and even frightening. We recommend that you continue to be prayerful for God's guidance and to hear His voice. We recommend that you arm yourself with information from reliable sources to make the best decisions for you and your family. Talk to your doctor about your individual health and well-being. But remember, our individual decisions affect the well-being of all of us. We love you, and we take this effort to inform you very seriously. As the pandemic winds down, hopefully for good, stay informed, stay vigilant, and stay prepared. But as always, stay safe, stay healthy, and stay prayed up. One more note, there will be a vaccination clinic in conjunction with Meharry at the church on June 26th. That's a Saturday. You can call the church office for more information. Take care.